Hi, my name's Maddie. I am working at Willett's Veterinary Clinic as one of their CVTs, and today I'm going to talk to you a little bit about maxillary canine extrusion. So maxillary canine extrusion is a condition where the canine teeth of your cat start to extrude or literally come and fall out of the mouth. This can happen due to trauma, or it can also happen because cats are cats, and sometimes, this is something that the body just does. The teeth will tend to look longer, so they'll look a little bit like vampire fangs. This may be seen in conjunction with severe inflammation of the gums. So the gums will appear really puffy, really inflamed, and you can also see gum recession, which means that the gum line starts to move back up towards the bone, exposing more of the root of the tooth. So a little bit about who can get this. This condition is most often seen in middle-aged or geriatric cats. There have been some studies to suggest that maxillary canine extrusion is associated with cats that have tooth resorption, and this is where the tooth is literally reabsorbed back into the body. And a lot of times the tooth resorption will be covered with the gums of the gingiva to try and cover the hole at which the the hole that was created in the root. And that is something that we can also see in conjunction with this canine maxillary extrusion. So a little bit about diagnosis. A lot of times we're going to want to just get a good look inside the mouth. This is going to be the main way of diagnosing this condition. So what the doctor is going to be looking for inside of the mouth is inflammation around the canines, gingival recession, mobility of the tooth, seeing or whether or not it's like super loose and gonna fall out, or if it still has some tightness in there. Also, we're probably going to be looking for like pocketing underneath the gum, seeing if there's any sort of infection in there. So another thing that we can do to diagnose this would be to do some radiographs or dental CT scan of the teeth itself. And so what this is going to do is this is going to give us a good image of what the tooth looks like up in the bone. And once we determine how loose it is or how far out the canine is actually like extruded, we can determine what our treatment is going to be going forward. So treatment, because unfortunately this condition is usually caught at the later stages, the tooth most likely is going to need to be extracted. However, if the tooth shows no sign of mobility, the tooth may be able to stay. Also, if there's no like bone loss on the CT or radiographs, the tooth has more of a chance to be able to stay. Because of the length of the tooth, like I said before, it can start to chafe the bottom lip, which is not good. So if the tooth is still like holding its mobility and doesn't have a lot of bone loss, what we can do is we can just blunt the tips of those teeth, and that'll save you trauma to the bottom lip, and you can also be able to keep the tooth and not have to extract it. So a little bit about the costs. So I kind of broke it down into what your money you're spending is going into. So our radiograph or our dental CT scan, whichever one you choose, is going to be about $220. Our general anesthesia is going to be about $111, and this includes our pre-anesthetic and induction drugs. Anesthetic monitoring is about $40, and our local nerve block, which is about $31. This is going to help us give the ultimate like pain control towards your cat, so that when he wakes up, he's not going to feel the loss of that tooth if we in fact do have to extrude or take out that tooth. So tooth extractions are going to be $56 to $28, depending if it's a complicated or uncomplicated extraction. And all that means is whether or not we have to actually go up into the gums and extract the tooth that way, or if the tooth is so loose that we can literally just pop it out. So we're looking at our total estimate to be about $430 to $458. Give or take a little bit, depending whether or not we're actually extracting the tooth, or if we're going ahead and blunting those tips if the tooth is able to stay. So if you have any other questions, our phone number is here on the brochure. We can definitely talk about our treatments going forward. And if you have any other questions, just contact us, and we'll get your answers answered.